The National Institute on Drug Abuse reports Tennessee providers wrote 94.4 opioid prescriptions for every 100 people in 2017, the third highest prescribing rate in the country, 1.5 times greater than the average U.S. rate. Another group of medical professionals trying to lower the number of people who abuse opioids by offering some pain-relieving alternatives.
Physical therapists are experts in the areas of movement and exercise. But if you can get that patient to a level where exercise really agrees with them, then it certainly subsides and really does away with that pain part.
Alan Mead, director of HMG Rehabilitation, says the goal of physical therapists and other therapists is to restore the body safely without the need for prolonged opioid use.
Physical therapy basically is really restoring people's functionality, whether it be pain-related or decreased mobility or some kind of limitation of some kind. It allows for physical therapy, the profession, to move in and through comprehensive treatment and through other methods, we can get that patient back to complete functionality.
Mead says often patients are prescribed more opioids than necessary, and wanting to be good patients, they take them.
We need to empower our community. We need to empower the patient and educate our patient to say, hey, you know, you might need 3 or maybe 4, but you don't need all 30.
Mead says taking a team approach and using as many resources available will help patients heal with minimal painkillers.
Even from the primary care perspective and from the specialist orthopedic side, they're still going to utilize other disciplines in healthcare that are going to help them reduce their pain and increase their overall functionality. The opioid crisis is like a diagnosis of cancer. It's not a respecter of persons. And we have families in this community that are hurting, and there are families, not only individuals from the problem itself, but also families that are hurting as well. And we need to reach out and educate those as well.
Alan Mead is also the president of the Tennessee Physical Therapy Association. He says recently he testified at the state level and the legislature moved a bill forward that read physical therapists, chiropractors, acupuncturists should be labeled as alternatives to pain medicine. That opens the door for insurance companies to hopefully cover more of those therapies.